Well, as a physician, what I've been seeing over the past 12 years in practice is that metabolic syndrome, just even obesity, has been growing exponentially. It's a big problem. And what we're finding is that although diabetes is growing, there's got to be some process to get from normal to diabetes. And that's how I kind of place metabolic syndrome. If you take a time spectrum, and on one end you have the normal person with no problems, and then the other spectrum you have the diabetic or the full-blown type 2 diabetic patient, there's got to be something in between. And that's kind of where I put metabolic syndrome. Basically, metabolic syndrome is a constellation of symptoms where people go from being quote-unquote normal without diabetes, and they're in the process of becoming a diabetic. Unfortunately, modern medicine hasn't caught up. And the problem is that people think they're diabetic when their sugar rises, and unfortunately, things happen before the sugar actually rises to a certain point. And actually, it's the insulin level that seems to be the biggest problem. What people don't realize is that there's two components to this. There's the genetic component involved in here, in this situation where people become obese partly because they have a genetic disorder. In addition, there's the environmental things. For example, overeating, what the content of the food is, etc. But by just manufacturing a change in diet, unfortunately, isn't always going to cure somebody of this disorder because there are genetic factors as well. Well, the difference between metabolic syndrome and actual diabetes, I guess I'm going to go back a little bit. What takes somebody from normal to metabolic syndrome, and then from metabolic syndrome to full-blown diabetes? What we do now in medicine is we've been deciding that diabetics are people that have hyperglycemia, glucose that is actually measured greater than 125, and that's full-blown diabetes. Then you take the person who's normal, who's less than 100. So there's this in-between zone, which some people have termed pre-diabetes, etc., between 100 and 125. And maybe some people may call that metabolic syndrome. I don't really look at it quite like that. And what we don't do enough of is monitoring insulin levels. So for example, when a person has hyperinsulinemia or high insulin levels compared to normal, they can even be as high as the person who's actually type 2 diabetic, but because the insulin level has kept its sugar in check, those people are considered to be metabolic syndrome. So they have all the changes going on as in the type 2 diabetic, high insulin levels, but their glucose is kept under control still by the high insulin levels. Therefore, since high insulin levels cause the problems that exist in diabetes, they also cause the same problems in the metabolic syndrome patient. For example, hyperinsulinemia causes all these complications. Weight gain, that's what causes the weight gain in diabetes, not just the sugar. It also causes fatigue. A lot of the number 1 or number 2 complaint in people that are overweight with metabolic syndrome or actual type 2 diabetes. Number 3, hyperinsulinemia also causes all the cardiovascular complications. Hyperinsulinemia by itself, high insulin, all by itself regardless of anything else, increases the risk of heart attacks and strokes. So I take this difference between metabolic syndrome and actual type 2 diabetes as just like a rubber band. If you take a rubber band that's normal and it has elasticity, you stretch it, it goes back. You stretch it, it goes back. Metabolic syndrome is when you stretched it to almost its maximum point. But if you cure it, treat it, it would go back to normal. The difference between that and diabetes is when you stretch it just a little bit too far and the rubber band snaps. That's actually type 2 diabetes. If you take the average person, what happens is their liver and their pancreas are involved specifically with the foods you eat in maintaining and regulating glycemic control. So for example, a normal person with normal genetics, normal eating habits would eat food, it would then be processed by the liver, which turns that food into simple sugars. They call that gluconeogenesis. The body's pancreas then has islet cells, and those islet cells produce insulin, and their sole goal or purpose is to neutralize the sugar that's in the body that comes out of the food you eat. So that's a pretty simple system. And the interesting or the amazing part about the body is that it can do that within a very tight control. So for example, if you eat a little higher sugar load, it will give a little more insulin. It doesn't give too much, it doesn't give too little. However, there are people that have genetic disorders, and these genetic disorders that create type 2 diabetes and metabolic syndrome, along with people that actually just overeat or eat poorly, those symptoms and those syndromes can then overload the liver. And what happens is the liver produces too much glucose or makes too much glucose out of the food that you eat, presents that to the pancreas. The pancreas then overproduces insulin. And what ends up happening is you have this excess in sugar, glucose, and this excess in insulin. Eventually, what happens in the type 2 diabetic is when the sugar overproduces enough to where the pancreas can't keep up to it. So you essentially end up with excess glucose above and beyond the maximum produced insulin by the pancreas. At that point, the sugar shows as high in your bloodstream, greater than 125 when you're fasting. At that point, you're considered to have full-blown diabetes. Now the bummer is that at that point, you have full-blown diabetes with hyperinsulinemia as well. So all the complications that occur come not only from high glucose, but also from high insulin. In the person with metabolic syndrome, regardless of their genetics, in other words, whether they have a genetic disorder or they've overeaten or both, what happens at that point is the pancreas keeps up with the sugar level that's overproduced. The insulin makes excess glucose from what you've eaten, and then the pancreas makes enough insulin, but it's still too much for the body compared to normal. At that point, you have hyperinsulinemia just like the diabetic, but your sugar still registers normal because the insulin's neutralizing it. And that's the crux of the problem with metabolic syndrome. If you go to your routine physician who doesn't really understand the process, unfortunately what happens is they check your sugar, and if your glucose turns out normal, it doesn't tell you whether or not your insulin is high or low. How much insulin is it taking to neutralize and make my sugar normal? If it's a lot, more than normal, then you have metabolic syndrome with all the complications of diabetes, which will one day turn into diabetes. Now, the big crux here is that if you treat metabolic syndrome correctly and aggressively, you can actually reverse that syndrome, whether it's genetic or not. Whereas the type 2 diabetic is much more difficult to actually reverse at that point. Well, treatment for metabolic syndrome and diabetes are very interesting dilemmas today. The problem is finding people that understand the mechanism by which things are working. So we said that you have a problem with gluconeogenesis in the liver, therefore it makes sense to attack that. We also said that there's a problem with hyperinsulin secretion by the pancreas. Would be nice to shut that down, slow that down, or actually attack that directly as well. We also said that some people are just overeaters, whether they have the genetics or not, and attacking that would be a huge issue as well. So I think that treatment for metabolic syndrome and diabetes as well is exceptionally multifactorial. You've got to attack from multiple spots in order to get a cure. So first thing and foremost is diet and exercise. Specific diets, attacking low carbs, low sugars, is exceptionally important. There are various different diets out there, but the concept that presenting less sugars or substances that turn into sugars by the liver, such as carbs, actually is the first step for everybody. The next step is exercise. You can burn calories and burn sugars and actually stimulate the production or the breakdown of sugars by the liver by exercising. And believe it or not, aerobic exercise is the thing. And I'm talking not 30 minutes twice a week, I'm talking 45 minutes to an hour 5 times a week. Much more aggressive than what people have first thought, even physicians, what we first thought. Then there is a role for medicines, and this is where there's a lot of controversy on what are the correct medicines and how aggressive do we get with medicines. As I'll find in my practice frequently with patients is that you have to be quite aggressive, to work on reducing sugar, because if you reduce that sugar level by the liver, then the pancreas sees less sugar presented to it, therefore the insulin level drops. The frequent problem is people say, okay, how long does it take? I've done my medicine, I've done my exercise, I've done my diet, and it's 4 weeks later and I haven't lost more than 3 pounds. Well, it gets very difficult to maintain somebody's motivation, so to speak, if you're not losing weight quickly. So education is the big key. It may take somebody 3 months to drop their insulin levels to a significant point where their weight actually starts dropping. In other words, Rome wasn't built in a day, and therefore, unfortunately, depending upon how severe you are and how high your insulin level is by measuring it, will depend on how long and how diligent it is before your weight starts coming off. So I think the treatments with medication are an absolute part of treatment for metabolic syndrome. There are different medications, one being metformin, which is a medicine that works on gluconeogenesis in the liver. The other thing is limiting medicines, not just treating with them, but limiting medicines that increase insulin production, such as a large percentage of medicines that treat diabetes. Frequently, diabetics are treated with medication class called sulfonylureas. Back when I started in medicine, sulfonylureas were probably the mainstay of therapy for type 2 diabetics that required medicine other than insulin or prior to insulin initiation. Well, lots changed, and I can't think of a sulfonylurea that I've written probably in the last almost 8 to 10 years of practice. And as we learn more, what we found is that the way sulfonylureas, which were really standard of care in medicine, was to stimulate the pancreas to make more insulin to neutralize the sugar that was made by the liver. Well, it's funny because now I'm telling you is that what we're trying to do is reduce insulin levels. And so sulfonylureas would be exactly opposite what I'm trying to treat for metabolic syndrome or even type 2 diabetes at this point. If the focus is to reduce insulin levels, not solely just glucose levels, then we have to attack from multiple levels, but one of those is by removing sulfonylureas from somebody's medication regimen. Sulfonylureas are very commonly a predisposing factor to taking somebody from either metabolic syndrome to type 2 diabetes, or from type 2 diabetes eventually to insulin requiring diabetes. Because what happens is eventually the sulfonylureas, the best way to characterize it is like a jockey taking a whip to a horse to try and make him run faster. Well, the sulfonylurea is basically stimulating the pancreas above and beyond where it can function to a high enough level for a long enough time that eventually the pancreas will burn out and no longer be able to produce enough insulin to keep up with the requirement of the sugar. At that point, the person's only hope is using insulin. The other kicker is, remember, every second that you are using a sulfonylurea to increase your insulin levels to then neutralize your sugar, you have the complications of hyper or too high insulin levels. And what is that? Specifically, weight gain. So now your treatment for your sugar is not only not doing an adequate job of lowering your glucose or neutralizing your glucose levels, but it's increasing your weight in the process. So it's flushing the proverbial toilet. You are now taking a medicine to neutralize glucose, then you neutralize the glucose by increasing the insulin level. The increased insulin level then makes you hungry, makes you eat more, you gain more weight, your sugar goes up further, then you need more sulfonylurea, and so forth.